Good afternoon, everyone. This is County Executive Pat Ryan, if I can get my words out today. It's good to be with you all, at least via camera here, and I hope everyone is doing well, enjoying another beautiful day. And overall, today it's going to be a good update. We have pretty much all good news to share, so that is always a nice way to start our 30 minutes or so here, or maybe 20 minutes together. We'll dive right in. We're going to do some public health updates with COVID-19, and then I'm also going to talk about some of our recovery efforts, in particular what we're doing to address substance abuse and substance use disorder issues and overall behavioral health challenges that we're seeing in the county. But first, the numbers. So we continue to see the cumulative number go up, but at a very low rate. We now are at 1,782 total positive cases since March, out of 26,400 and some individuals tested. So that overall aggregate percentage is now down to 6.7%. And again, that's over the whole period of the COVID pandemic here. We've been well below 10% for a few weeks now. Our unfortunately fatality number is 83, but the only small good piece of news is that we have not had, thank God, any fatalities in the county for several days, and of course hope that continues to be the case. We do have a few folks in the hospital, which we'll talk about, but those numbers are going down, and it will be a very good day when we can finally say that we have not had one of those for an extended period of time. In good news, we've had 1,368 residents recovered. So the vast, percentage of the 1,782 have recovered already. And if you look 10 days out on our projections, we're essentially at a really flat growth, and we'll talk about that. But probably the best update I've been able to give in a few months was that on Sunday, so the 24-hour period of Sunday, for the first time since the pandemic, we had 0 new positive cases out of over 500 tested. So man, did that feel good to say that. And we hope we can continue that trend. And we basically did in the last 24 hours, and we'll talk about that in a minute. In terms of our hospitalization numbers, those also continue to go down. We are now at, thankfully, only 3 individuals in Ulster County hospitals, only 3, one of whom is in the ICU still. But we had been at 7 for quite a while, and so it's good to see that number come down to 3. And that's our goal, obviously, is to get that one especially down to 0 with recovered cases of those 3 right now. In terms of current active cases in the county, so yes, we've had 1,700 plus positives over time, but right now in Ulster County, there are only 331 known active positive cases of those who have not recovered. And again, that's the lowest that has been since going back into late March, early April. In terms of our daily tests and new positive cases, thanks to all of you for taking advantage of the testing sites that we have. For the last 3-4 weeks, we've had anywhere from 400 to over 1,000 new tests per day, every day consistently. And that is very important, that we continue to maintain our testing capacity, and that as more people are going back to work, at any point, if they feel that they have symptoms or have been exposed or want to be tested, that you know that capability exists. We still have 4 testing locations at large scale, as well as many individual private practices that are testing. In the last 24 hours, we were so close. We were so close. We tested 555. We had 1 positive case out of 555. So I was hoping I'd be able to say we had a 48-hour streak of 0, but we're pretty close. In the last 48 hours, well over 1,000 residents tested and only 1 COVID positive. And we hope that individual, of course, is on the path to being to recovery as quickly as possible. And then final public health update really is about our hospital and our treatment capacity, another graph that we regularly look at. This is the first time we're below 5. We're now at 3 hospital beds total, one of those being ICU. I do, and some of you may have seen this on the news, some of the local news covered this, but I did want to share a really powerful story. It's the first time we've talked really about any particular case, but I think this is important for people to hear. So many of the folks that have really been fighting COVID have had a long, in many cases, multiple months battle to fight this thing. And we know, unfortunately, that 83 of our fellow community members did succumb to the virus. But probably the coolest story I've heard in quite a while, a gentleman from Port Ewan who is also a volunteer firefighter, is actually the second assistant chief in the Port Ewan Fire Department, George Banks, was just released in the last 48 hours from Westchester Medical after 10 weeks in the ICU fighting COVID-19, defying really all of the odds. And he was greeted, if you've seen the video on TV, with a pretty powerful and moving ceremony and recognition for him and his family. And on behalf of all the residents of the county, George, we're really glad that you hung on and fought, and we appreciate you not just for that, but for being the kind of person that if you weren't sick, you'd be out there with your fellow first responders taking care of others. So I think that's a story we should all reflect on, that even those that are fighting should not give up hope, and we should not give up hope on them. And we definitely won't do that for those that we know are still fighting COVID-19 right now. Shifting gears just a little bit, I want to talk about how our recovery is going and how really our overarching economic resilience plan is going. And as a reminder, that really has 3 components to it. It's about recover, it's about reopen, and it's about realign. And in terms of reopening, which is getting our businesses going again, as you well know, we're deep into phase 2 now. I finally got a haircut, for those of you that are regular viewers, thank God. I think I lost a few pounds, which I also needed to do, so that was a twofer. We have about 80+% of our businesses now open under phase 1 and 2 with of course some safety restrictions. So I want to thank all of our businesses that have put in the work to build those business safety plans, to make sure their workers are safe, their customers are safe, and that we can all get going and reopened, but do it safely and confidently that we're going to be okay. And thankfully we are seeing that in the numbers, as I just talked about, that even with phase 1 3 weeks in plus, and phase 2 now over a week, we're still looking good in those numbers, thankfully, and that's a credit to everyone. So please celebrate the progress, and of course we should, but also I caveat that with a large dose of caution that this is not the time to let our guard down. In fact, it's the time to be even more careful and cautious and thoughtful of others as well. In terms of the recovery efforts, and what this again is really about is families and individuals who are recovering in terms of economic need, housing need, mental health needs, addiction recovery needs, as well as businesses and getting them loans and all the support they need to brace from the immediate impacts. We are still working, and our recovery task force is working on all of those different pieces of our efforts, so that even as we see the effects of the health dynamics continue to decline, we know that the needs of our residents are actually greater and greater due to just all the economic pressure and the other pressures that we've all been under for over 3 months now. So with that in mind, our recovery task force, we've taken a series of steps on housing. Of course, we've addressed food need with Project Resilience and other food security efforts. And what I want to talk about today is our work in addressing head-on addiction, substance use disorders. And we have unfortunately seen in the last few months our overdose numbers go up some, our overdose deaths unfortunately go up some from last year. And we had made such good headway in 2019 that it's really difficult and disheartening to see those numbers start to creep up. So we are very proactively working to tackle that, as I've been focused on really over the last year in office, of tackling the opioid epidemic as one of my big 5 priorities. So we're not only continuing that work, but really doubling down with 2 significant initiatives that I want to talk about today that will help to address this problem and try to get this back to a more manageable, tolerable level. Ideally, of course, we have to get to 0 on that as well. The first thing I want to address is our inpatient detox treatment beds. So many of you are aware that because of the need or the potential need for a COVID surge hospital, Health Alliance had to move some of their behavioral health beds, both mental health and detox, out of Mary's Avenue campus over on the Health Alliance hospital campus, and temporarily move those to Dutchess County. You probably are also aware that I raised and have very serious concerns about that, because at a moment where we're seeing this need go up, the last thing we need to be doing is removing any kinds of services, inpatient or outpatient, to address this epidemic. So a few weeks ago, I wrote a letter of concern to the CEO of the Westchester system. To their credit, they immediately engaged in that conversation. We're having productive conversations about the long-term plan for our behavioral health needs here in the county, and I will continue to fight and work to make sure that we have those needs met here in the county. But I really want to thank and recognize that Health Alliance has stepped up, and as a short-term solution, they are now offering inpatient substance use disorder, detox, commonly known as detox services, at the Broadway campus in Ulster County, and they've been able to repurpose some of the sort of normal beds known as med-surg beds to offer the full complement of inpatient substance use disorder services. So that means that anyone struggling that needs inpatient services, whether Ulster County resident or otherwise, can go to the Broadway campus, go through the ED, and get those services right here, and then get also connected into the other network of outpatient services and support services that are necessary to get to battle the substance use disorder that they are battling. So that is a big win for Ulster County, and I really do want to thank Westchester CEO Mike Israel, Dr. Mike Doyle, the Executive Director of Health Alliance, and your teams. We really appreciate this. Obviously, we're still going to keep working to address the long-term solution, but this is a very important immediate capability that we desperately need and that we now have in the county. So thank you for that. The second piece here, in addition to having the inpatient beds and of course all the continuum of care that includes all the other pieces, we know, and when you really look at the data, as we've started to do over the last year, we know that those suffering from overdoses and overdose deaths are often those that have a long-term battle with addiction and substance use disorder, and that many of these individuals, we know and we have seen them present with these challenges before, often make progress and then backslide for whatever reasons. And we recognize that there's a certain relatively small number of folks who need a very high level of support and care if they're going to overcome the challenges that they face. And we are, of course, committed to doing that. So as part of our overarching opioid prevention work and tackling the opioid epidemic, we're launching a new effort called the High Risk Mitigation Team. And really, this is a very high-touch, in-depth program focused on those at the highest risk with the greatest need. And in the most cases, these are individuals that have had long-standing battles with addiction that we've worked with before. We're going to start a pilot of this program in partnership with the City of Kingston and various agencies within the City of Kingston, including working directly with first responders who are, in almost every case, the first ones on the scene, who will identify the need for someone to get put into this program. And then the key here is we're going to carefully follow those individuals, those high-risk individuals, throughout the entire continuum of care so that they don't slip through the cracks, so that they aren't, as they transition out of a hospital, for example, they're not just left on their own to try to figure out, okay, now what do I do? I've received those necessary inpatient services, thankfully now at the Broadway campus, but where do I go from here? How do I go home or go where I need to go and get the support that I need? So we're working with a series of other not-for-profit partners as well, and the key services that will be included here, and this is one of the most critical, peer-to-peer services. So someone who has themselves experienced this journey successfully, and those individuals will go and meet the members of the program right at the hospital as they're transitioning out and help them navigate as a trusted peer. Other harm reduction measures and medication-assisted treatment, recognizing that this is a disease that we need to treat with medicine and medication and medical approaches, and that we have the tools to do that, as well as opioid use disorder prevention education and other critical recovery services. So this really is an innovative program, and it's part of our broader Healing Communities grant and program, which is funded all by federal dollars, which we started to receive at the end of 2019, and this is our first full year of this program. So I do want to thank our federal partners, as well as Columbia University, that is really our main academic and research and execution partner on this. We've talked about this grant before. This is going to provide Ulster County with around $2 million over approximately a 3-year period in federal grant funding to fund a multitude of different initiatives, and the high-risk mitigation team is just one of those. But this really is the centerpiece of our program, because it recognizes that if we really focus on those with the greatest need, in most cases we know who these individuals are, and we use data to inform that. We use new innovative practices, and we have that whole continuum where we're following people through, not letting them slip through those cracks in the system. This is really going to be critical to ultimately saving lives. Most opioid overdose deaths come from someone who has had one or more non-lethal overdoses already. So that is a known universe of people that we can work with and help and make sure that, of course, we save their lives, and then that we also work to help them battle the substance use disorder that they're working on. Ulster County is just one of 16 counties in the state that is participating in this federal program, and there are 3 other states in addition to New York as well. So in the midst of COVID, in the midst of a once-in-a-century pandemic, we are going to continue to focus on fighting COVID, but we also have to recognize the pressures that both from a health perspective and an economic and social perspective that are being put on everyone in our community, especially the most vulnerable members. And so it's not a surprise we've seen the numbers go up on overdose, and we have to respond to that. We are responding to that, and I'm confident that this program, particularly the high-risk mitigation team, is going to be a critical piece of tackling the epidemic. So I want to thank everybody that's involved in that. That's going to include many from the city of Kingston, a host of nonprofit partners. The sheriff's team will play a role here, and I thank them for all the work they're doing on this effort and have been doing. So more to come as we get this going, but I wanted to make sure everyone knows we're aware of this challenge and we are working on it. As we wrap up, just to shift back, I probably should have had this slide earlier. I want to do one more reminder, though, that as we are well into phase 2, and thankfully for our businesses and our other organizations, I am seeing every time I'm out and about, which I try to minimize, but every time I'm out and about, I am seeing more people out. I'd say 95% of the time, plus I myself am observing people doing the right things, and I appreciate that. But we have to constantly remind ourselves and remind others that we know the path out of this that will keep us as safe as possible and really minimize that risk. And that is wearing masks, following the social distancing guidelines, and washing hands and using hand sanitizer. All things that are kind of annoying, particularly the masks, especially as it gets warm out, but things that are proven scientifically, and the evidence continues to mount over time to validate that especially masks and distancing, particularly when you're outside, mitigate away almost all of the risk. And so that is something that matters, of course, to each of us, but also to everyone around us. So I appreciate everyone continuing to hang in there with that. And if we keep on this trend and seeing these numbers go down, I do think it's a result of what everyone's doing. And I know that in other states where we've seen spikes, they often coincide with a much more laissez-faire attitude as things are opening up and people saying, you know what, I'm sick of the mask, but it has consequences. So I appreciate everyone being mindful of that and helping in that regard. As we drive forward, I always like to end with, we mostly had, again, positive news today, but I like to remind folks of our still ongoing work to meet the food insecurity needs of thousands of households in the county through Project Resilience. We've now delivered 242,000 plus meals prepared and delivered across Ulster County, and we're continuing that and are on a trajectory now where we can continue that for quite some time. And then finally, just in an ending, thank you to everybody. Thank you to a growing list of folks that have that we talked about as frontline workers, but increasingly all of us are on sort of the quote unquote front line of getting back to what as close as we can get to normal, getting back to that in a way that just keeps in mind, again, the connectedness of our community and the fact that each of our decisions impacts others, and those that, especially at the worst of COVID, put themselves at great risk for all of us while we all sort of sheltered in place and stayed put. I want to continue to thank, and we want to continue to thank and recognize our healthcare workers, grocery store staff, postal delivery workers, mail carriers. That's the same thing. But not just mail, not U.S. Postal Service, but all the delivery workers, journalists, frontline workers, of course, law enforcement, teachers, first responders, and so many others. We appreciate you. We especially appreciate and celebrate the recovery of Mr. Banks from Port Ewan and every single resident that is winning the battle against this. We send our congratulations and our best wishes and our love to everybody out there. So thank you for tuning in. We will be, today is Tuesday, so we will be doing another update on Thursday at 2 p.m. And in the meantime, please stay safe, stay healthy, be resilient, and take care of each other. And we will see you in 48 hours.